Hi, this is Robert Fairchild talking about the Affordable Care Act and why it's causing a bubble. To begin with, back in 2010, the Affordable Care Act demanded health insurance companies to do X, Y, and Z. And so, with those demands, cost the cost of the operation to be this high. And since it was a lot higher than it was before the law, they had to pass the cost to the consumers. So the consumers who wasn't really using the health insurance policies before 2010 started to leave. And so so they're losing revenue. So the insurance companies are losing revenue, and they have to pay for a higher cost on all the medicines what they have to cover because X, Y, and Z, and that cost is just getting up more and more. And each time medical cost goes up, they have to raise the prices on the consumer, and people who are healthy have to look at two options. Gotta look for a cheaper plan, but that was kind of hard to find because of the Affordable Care Act, or pay $9,000 to the IRS because they have no health insurance. And that $9,000 came more affordable to pay the IRS than to buy health insurance from a company. So, anyways, it's created a bubble, and this bubble is created from the government. Example of a bubble created by the government: the 2008 housing bubble back in 2008, and we saw how destructive that was. That was not good. That was really bad for the housing industry. So, if the bubble continues is allowed to grow, it's going to burst at any day now. It could be tomorrow, it could be next week, could be a month, could be a year or 2 years. It's going to blow. And so when it blows up, it's going to destroy the health industry. And so, and since this bubble is not a free market bubble, there will not be no entrepreneurs making new companies like they did in the dot-com bubble. The dot-com bubble got to the point, exploded. Some older companies had some difficulties in dealing with the bubble, but a lot of new companies came about, like Google, YouTube, Facebook, Snapchat, Instagram, all the other social media, websites. So the dot-com bubble was very good for consumers because it was created by the free market and not by the government. And so Republicans don't want to do it, then because they don't want to tell 20 million people to say, sorry, we can't cover you, bye. They won't be playing for that, but they don't want the bubble to pop. So, Rand Paul and a few other Republicans have a plan to reform the health industry by a free market approach. Basically, telling the companies you can do whatever you want to compete in the market. Basically, they'll have to go jump in the basically the insurance companies have to convince us why we should buy their product, and why it's beneficial to us to buy their health insurance company plans. So that means they'll have to make the health insurance policies affordable and something what the consumers want for health insurance reasons. So that's better for us. And I urge you guys to look at Rand Paul's free market approach. But on the other note, I know a lot of people has been helped by the Affordable Care Act, who are if they don't have, and these people I know who are with who has diabetes and also have disabilities. Um, and I know a lot of people with other conditions with they don't have the health insurance. They're up the creek by a paddle, and it's bad for them if the Affordable Care Act bubble pops or gets repealed and no plan. So I urge you guys, if you are actually concerned about are you actually concerned about the health industry and how your health is going to, how your health plans are going to look, or how you want, or how it's going to affect you as an individual, or how it affect you, your friends and family, I urge you to take a look at compare Paul Ryan's free market approach to the Affordable Care Act. You will see the free market approach is a lot better idea because the Affordable Care Act is social ideas watered down. So, and then once you see how good the free market, Paul Ryan free market sample is, I urge you guys to tell your representatives to support Rand Paul's free market approach to the healthcare system. So, and have a nice day.